rarely discussed in Indian scenario, and that is one of the reasons we thought we should be discussing menopause here today. So let us welcome Dr. Nandita Palshetkar. Thank you so much for coming down. It's such a pleasure to have you on the platform.
Thank you, Hema. I'm really looking forward to having a good chat with everybody. I gave my talk on menopause. I had the first slide, it's not hotmail.com, it's hotfemale.com. So we can
That's such a good one. That's such a good one. And also, menopause is not a disease. So a lot of times when we talk to men or people around us, they talk to it like a disease. These are the symptoms. How do you treat it? So we want to hear from you what exactly is menopause.
Hema, unfortunately, I feel menopause has got a stigma, but I think we should get over it because today women are spending one third of their lives in the menopause age group. Because the longevity has increased. We are there, we live till about 70, 75. So after 50, you do turn menopausal. The average age of menopause in our country is between 40 to 50 years. So what exactly is menopause? Menopause means this withdrawal of the hormones, the estrogen, the progesterone. These are the hormones which keep you healthy, happy, young, and as the ovary ages, these are the hormones which get withdrawn, and it's a process for aging. And basically, from fertility point of view, it means that the woman no longer has any oocytes or eggs, so she can't get pregnant. So that is what is menopause all about. But a lot of concepts are changing, so I'm going to talk about that at the end of my talk.
Yeah,
uh,
we'll wait for that. Now,
yeah.
before we jump into the topic, I want you to say something to all those men who actually came back to tell me this is not for us.
I think a woman undergoes a sea change in her constitution, okay, when she hits her menopause. And she needs all the support, all the help that she can get. And if the husband is with her and the family is with her, I think she can sail through this beautifully. So I think, Hema, it's very important that we actually educate the husbands what is menopause. And I hope there are a lot of men who have tuned in for today's program because they need to understand what a woman goes through. And maybe some other time we will have something called andropause also, what the men go through. But let's focus on the woman today. And as I said, we for three, we shall focus on the three and discuss all the problems. I think it's not a disease, but at the same time, it is a withdrawal of these hormones. And the woman does go through a lot of changes. And in the olden days, our mothers, grandmothers, said, okay, we have to suffer through it, it's fine. But today
Yeah.
we don't have to. There are different treatments of options available, and there's help. And most importantly, what you pointed out, I think the husband, the family, the children can be very supportive, and it does help the woman accept these changes and takes her through this part of her life.
So, Doctor, moving on to the aspect that, sometimes we're so busy with our lives, we don't realize. So, what are
Yeah,
the immediate signs and how do we know that, okay, now, the menopausal phase has begun?
begun. Hema, there are two phases which I would like to really talk about.
Yes.
One is the perimenopause and the menopause. Menopause meaning your periods have stopped. So for 1 year, you've not got any periods at all. And that is what is defined nowadays as menopause. Okay, and perimenopause is the 5 to 10 years before the woman actually becomes with amenorrheic, as we say in our language. That means no periods at all. That is 5 to 10 years. And there are symptoms which happen in the perimenopause, in the menopause for this girl. And it can be simple things like, irritability, mood swings, then hot flushes, sorry, sweats. You just sit there and you just sweat. Night sweats are more common than day sweats, but I have patients who also sweat during the day and they're totally traumatized by it. They can't handle it. So I think it's important that the education is given. And of course, the periods. Periods become irregular, periods become heavy, or you get, no periods at all. So the period symptomology is also there. The third symptomology is a decrease in the sexual desire. There is dryness of the vagina. So all those things also can affect. The libido is decreased. The next part is the genitourinary system, where you can have repeated urinary tract infections, frequency of urine increases, urge incontinence, like you can't hold your urine, you cough and it suddenly gives way. So all these are some of the symptoms. Then the bone health also gets affected. So you can have very easy fracturing. You can get pains and aches in the body. So all these things are definitely pointing towards it. And menopausal women also are more likely to get heart attacks. So they develop cardiac disease, they develop breathlessness, chest pain. It's a possibility.
Yeah.
But the first symptoms, which I said, are the most common ones, like hot flushes, night sweats, day sweats, mood swings, irritability, depression, insomnia. These are also very, very common.
Hmm. Also, why do some women have extensive symptoms and some women don't really have symptoms or
Yeah,
don't realize?
I think today the best message that I can actually give the audience is that we can actually make our menopause healthy. So you can start as early as your 30s. You know,
Wow.
uh, yeah, I mean, actually adolescent, because you start
Yeah.
exercising, and after the 30s you start weight bearing exercises, so that your
Hmm.
bone mass really improves, so you can maintain your bone health by doing that. Fortunately, we are dark skinned people, so the bone health is good in us. But like, you can use calcium supplements once you cross 35. You can start weight bearing exercise as early as in your 20s and 30s. So all this will help you get healthy. Then secondly, manage your weight, because after menopause your metabolism slows down, so you tend to put on weight much more easier, and it's difficult to lose it also. So I think if you maintain your weight in your normal BMI, it really helps you during your menopause. Too thin also is bad, and obese
Hmm.
is also bad. So I think being perfect, having a healthy lifestyle, and I'm a great believer in yoga, meditation, all these extra,
Yes.
holistic way of taking care of menopause. I think it's a wonderful way in which a woman, and mainly I think it's her mental health. So there, the people come into contact. You're working, so you're confident.
Hmm.
Your self-respect you've developed. So all these things are very important for a woman to transition into menopause in a very easy manner. But women who have problems, who self-worth, or they've undergone domestic abuse, there's so many problems which one can have, low self-esteem, all those girls, the menopause gets magnified. So I think the
Hmm.
mental health is also very, very important when you are transitioning into that phase. And that can be helped by your family also. Valuing the woman, giving her the respect that she deserves, the safety that she deserves, I think is very important also. See, because I personally feel that
Hmm.
50% of the symptoms are hormone deprivation, which we can take care of.
Right.
50% is psychological also, because psychiatric help is required. So therapy is required. And it can be in the form of anything. I feel the families can be very supportive. You don't have to go to a therapist to do it.
Hmm. Hmm. So, in fact, we have a question asking that do we put on weight? So,
Yes.
I guess it's yes.
I
So,
think that's a
no?
very good question. If you have to,
Okay.
even if you are slim, trim, during menopause, your metabolism slows down. So yes, you have a tendency to put on weight, so you have to put in double the effort, diet as much,
Yeah.
exercise as much.
Yes. So, apart from,
Check your thyroid also, because a lot of times there are thyroid problems,
okay.
and that can be the reason for weight gain. Prolactin hormone, a hormone of
Mm.
stress. So these two hormones need to be definitely looked at. Yeah, sorry to
Okay.
interrupt.
No problem. So, basically, we can prepare for a smooth menopause way
Absolutely. I
earlier.
think it's once you're aware of it, and once you know the symptoms, I think there's treatment for these symptoms. So women should not suffer. Absolutely
Absolutely.
not. If you have diabetes, you take treatment for diabetes. Similarly, if you have symptoms in menopause, you
Mm.
should take treatment. There was a lot of scare about the hormone
Mm.
replacement therapy and all, and I
There,
think
there was.
yeah, we'll discuss that as we go further. But I
Yeah.
think there is a lot of symptomatic treatment today available for menopause, and women should not be scared or worried about taking it.
So, when should a woman approach her doctor? When does she know that this is
Yeah,
the
as
time?
I said, the symptoms and the
Yeah.
quality of life gets affected, and she's really, there are lots of women I know who have such severe urinary symptoms that they stop going out, because every time they go out, they want to go to the bathroom, or they slough or sneeze, and the urine, leaks out,
Yeah.
and they are the odor is unbearable. So they go into a shell, they stay at home. So I think any kind of symptom that affects your quality of life, you should definitely go. And nowadays, I think I'm seeing a lot of change. Women are coming when they turn 40, 45, they just come, okay, we are entering a menopause. What
Okay.
are the precautions we should take? What should we do? And I think every gynecologist should ask their patients, do you have any symptoms? Because of the scare of that study,
Mm.
we do not prescribe the hormone replacement therapy so liberally. Okay, but
Yeah.
I am of the opinion that if it is monitored well, if it's taken well, and you don't have high risk factors, I think abroad everybody is using it, everybody is taking it. There are a lot of anti aging clinics, and I think it's all about anti aging eventually.
Mm. Absolutely. Now that you say, when I actually look back in our schools, we get training when our menstruation is about to begin, but we never get training when our menstruation is about to end. You know,
I know.
so it's so amazing that we are having this talk here, because I think this is one key aspect that even youngers need to know
So,
when they hit the
yeah.
timeline. Yeah, yeah.
And
So,
now we're seeing a lot of young girls. See, I'm in the field of IVF, test tube
yes,
babies. So I get a lot
yes.
of young girls who are coming for treatment. And I suddenly realized that their ovaries are aging much faster than what they should. And nearly 20% of my unexplained patients have ovarian aging. 20-25%, and it's probably because of pollution, because of stress, because of autoimmunity. So all these things are causing early aging in our girls, and we need to take care of their bone health, their heart health, general metabolic syndrome. Diabetes is a pandemic in our country, so
Yeah.
we have to take care of these things, because the incidence doubles once you hit menopause.
Hmm. Hmm. So there's another related question in the audience which says that why do some women menopause early and some women menopause late?
Generally, it's genetic. Your body is programmed for the menopause when you're born, and it's usually genetic. If your mother's had a menopause at 55, you will also get it post 50. But as I said, I just said before that there are
Yeah.
things like stress, pollution. There are a lot of, the plastics in which we drink water, carry
Hmm.
food, the preservatives, the pesticides. Some of these substances are hormone disruptors. In fact, the VOCs in the environment, all these things can cause early aging, and it is affecting our bodies. So I think a healthy lifestyle, and everybody needs to take care that we are not
Hmm.
contributing, not contributing to the worsening of the pollution. So each of us
Yeah.
needs to be aware, like stop kerosene burning in the houses.
Hmm.
That's a simple thing which can help.
Hmm.
So I think we can go on a different tangent. So
Yeah,
I'll come. Yeah, I'll
that's an
come back
endless
to
story.
the pause.
Yeah.
Yes, some girls get it early, some girls get it late. Mostly it's genetic, but even external factors can affect.
Okay.
And
Okay.
sometimes,
Now,
sorry, disease is also, Hema. Like
okay.
endometriosis has destroyed your ovary or something, or you've had surgery to remove the ovary. Like there's a surgical menopause. Like you have
Yeah.
an ovarian tumor, your ovary is removed. So any way
Hmm.
in which the ovaries are removed is again
Hmm.
menopause.
Okay. Okay. So, moving on to the treatment lines. So, what are the different kinds of therapies that we use for it?
See now, before that, the age at which some girls,
Yeah.
there
Yeah.
are 1 to 2% girls who hit menopause before 40, and that
My
is known
God.
as
Wow.
premature. Yeah, that is known as premature ovarian failure, and
Okay.
that's usually genetic reason, or it can be any like I said, pollution,
Hmm.
stress, autoimmunity. So it's very important for a woman, for a girl, to understand this, because when she hits menopause, she generally cannot conceive. So I'm a little bit digressing over here, but young girls can do their blood test, which will actually tell them about their aging process.
Hmm.
It's not very accurate, but we fertility specialists do use it. It's a blood test, simple blood test called serum AMH. So if you're a young girl who's, studying, who doesn't want to have a child soon, or even a married girl, who doesn't want to have children so soon, you can just do your AMH. So it kind of tells you how far or how close you are to menopause, and it does. Predict in a lot of cases, but we have other factors also, like hormone tests for serum FSH, serum LH. Those things also help us in diagnosis of menopause. So menopause can actually be diagnosed biochemically by a blood test also.
Okay.
So
That is interesting.
yeah, I think you came to this treatment part of it.
Yeah.
The
Yeah.
treatment
Assuming
is,
you're assuming that the diagnosis is self-diagnosis.
yeah, I think the best treatment is a hormone replacement therapy. And
Okay.
the earlier it is started with the symptoms, the better effect it has. But right now, the hormone replacement therapy has been, advised for only 5 years. So you should not have history of breast cancer, any history of DVT, that's deep vein thrombosis, that means clots in your body, you could get a stroke or something. So these are the conditions where it's contraindicated. But otherwise, hormone replacement therapy, that is estrogen and progesterone, actually takes care of all the symptoms. And I would like to divide it in
Yeah.
particular. A lot of my girls don't like hormones. Okay, they say,
Yeah.
"Doc, can you give us anything but hormones?" So yes, we do have some phytoestrogens and some new molecules which have just come in, and they are showing very very good results. So we prescribe those medicines for them. These are biosimilars. They are molecules which have an estrogenic and progesterogenic effect, and those are the drugs that we use. So if my patient does not respond to the primary therapy, then I advise them hormone replacement therapy. But personally, I feel women are deprived of testosterone also,
Hmm.
and the DHEA hormone. All these hormones, if they're given to the woman, I think it's really, really wonderful. And there are hormone supplements which are available, especially women who have
Hmm.
low sexual drive, decreased libido. A little bit of testosterone definitely improves that.
Right.
Then the urinary symptoms. They are, some people just have urinary symptoms, and that is because of the drying up of the vagina, the mucosa. So we have local estrogen therapy for the urinary symptoms, and it works wonderful, and you can use it lifelong. But now there are new technologies that is the laser activation of the collagen in the vagina. So you have these cosmetic cosmetic gynecologists, or
mm,
it's vaginal lasers and vaginal instruments which we use to rejuvenate the vagina. And I think those also help in, urinary problems. They help in the dry vaginas, atrophic vaginas. So lots
mm.
of new things have come, and I think the gynecologist needs to get the patient
Broaden. Yeah.
and treat her accordingly. So urinary symptoms have options available.
Mm. So, also, I wanted to talk a little more about the hormonal therapy because
Yeah.
that's a huge stigma, especially in Indian population. They think if you the prescribe hormones or take hormones, your system
Hormones are
becomes
bad.
haywire. Yeah,
I
hormones are bad. Yeah,
It all began actually in the early 60s and 70s, where the hormone pill, which was introduced, had a
mm,
very high level of hormones. You understand? So it had a lot
yeah,
of problems, bloating, weight gain, this, that. But now, if you look at 2012, the pills have changed. All the side effects that we see are not there with these new pills. So in fact, hormone replacement therapy is a little higher dose, but the oral contraceptive pills that are there, the girls are not willing because their mothers have told them it's bad. So it's
yeah,
time people understand that the pills have also undergone a change. You don't put on weight. You don't. In fact, your skin clears up. The acne, the hirsutism, the hair and all clears up
yes,
with these pills. So it's really good. So similarly, of the HRT, what happened with hormone replacement therapy is there was a big scare that you get breast cancer with hormone
yeah,
replacement therapy. And this study, it was a very flawed study, and it did show a slight increase in breast cancer and an increase in strokes. But remember one thing, any medicine, it doesn't come without side effects. So yes,
yeah,
the chance was there, but it just increased by one patient or two patients per 10,000. So the incidence didn't really increase. Before that, people were taking HRT, knowing
yeah,
that the risk of breast cancer, risk of stroke is that much. You need to, monitor these patients. But because of the study, it suddenly put a brake on the hormone replacement therapy. And I think it's coming back now because we have more safer options. We have the doses which are, helping people.
mm, mm. Also, can you tell us a little more about bone health and menopause and how can one prevent that apart from taking calcium supplements only?
See, I think what I said was it all begins in your 20s and 30s. So you really
Okay.
need to have a very healthy lifestyle. If you exercise, have a healthy diet, your bone mass is good when you reach 35. Because after 35, the bone mass decreases. And that is why it's important to build it up before. So I'm really glad if there are young girls who are listening and, this kind of a message goes to all of them that build up your bone mass till 35. And
Mm,
those who are already in the menopause, I think they can do some weight bearing exercises, because that again builds your bone mass. And I think yoga is also good in flexibility, the tendons, everything. It improves your body tone, and I think you have to maintain that body tone also. So the exercising, which helps maintain the bone mass, the body tone, and of course your stamina, that will really help you
yeah,
build up your bones. There is a problem because very fair people have very brittle bones. So these are the people who really do exercise and take care that they have an increased bone mass. Now, how can you figure it out? There is a test called bone densitometry. So
mm,
we have a scanning machine which scans the entire body, and if you do have a drop in it, then you can use, medicines to build up your bone mass. And there are different medicines. There's alendronate, there is tibolone. So each patient has a different requirement. So once we assess them, then we give them, and you can definitely, help them get a better a better density.
So it's very specific to every patient.
Yeah, and also, once you are in your menopause, you're more prone to fractures. So you have to be very careful. When you're walking, you should look where you're walking. I think prevention is always better than cure. You should look, you should not fall. And especially in the 80 plus women, if they have a fracture or something, the mortality is very high within 1 year of the fracture. They have some kind of an accident or something or embolism and they pass away. So you have to be careful about not having fractures, not falling down, taking care of yourself. And I think the important thing is using a stick. It doesn't matter. You should not feel that, oh, I'm going to look old. I think just get those fancy designer sticks, as I would say. And, but be careful. Be careful. There's no harm in
My
holding
God,
some.
I love your spirit. I love your spirit. So I know I have a couple of people who are currently entering the perimenopausal phase right now. So what's your message to them? So
Perimenopause can be traumatic, and your mood swings really, you have mood swings. So, if it's a lot, if it's causing insomnia, it's causing anxiety, it's causing depression, please take help. I think there is absolutely no shame in taking help. So you can go to your gynecologist, you can go to a mental health specialist, and together, see, menopause is holistic. We usually work with the orthopedician, with the mental health specialist, with the cardiologist, to make that woman healthy. So I think it's very, very good to know that everybody works together. And the diabetes and the blood pressure is highly preventable. You can actually work on yourself, keep your weight down, do a lot of walking or breathing exercises now, especially in COVID. I think the breathing exercises are very important because it improves. Let me tell you one incident which happened. One of my friends, I mean, I'm also in the menopause, okay, but her mother-in-law had COVID and she came out of it absolutely fine. So we were just talking. She's saying she sings every day. She does her riyaz. So her lungs are fantastic. An
yeah,
85-year-old who does riyaz every day.
wow.
So certain things, like singing, breathing exercises would really help. So we need to look at all these alternative ways also of adding to our lifestyle, which will keep us healthy. That was
Adding to your lifestyle and enjoying it also. Yeah, that was
Yeah,
beautiful.
and it gives you a lot of pleasure. I
Yeah,
can't sing
that
for
was
nuts. If
beautiful.
I stop singing, no. They tell me stop singing. So but I think I need to exercise my lungs. So start screaming. The laughter club. That's also an amazing form of exercise for the lungs.
I think youngsters make a lot of fun about the laughter club though.
No, no, no. I think, they don't realize. Once they go, they realize the value. They teach you a lot of breathing techniques and it's really opens up your lungs.
And I know probably this is a little off topic, but since we picked it up, I want to talk about weight training because I've got this very frequently. A lot of girls get into cardio a lot, and they don't want to do weight training, because they build muscles and because they think they have to lose weight. So, what
Yeah.
is the importance of weight training? I want to talk a little bit about that.
I think the balance is very important. A woman doesn't have to become muscular, but it's how the eye perceives the beauty. Okay, I think
Yeah.
some women like themselves muscular. They love the defined muscles and all that. I think anything done in moderation is good for health. And even if you're doing a lot of weight training, you shouldn't injure yourself. And those who are scared of weight training, I think a little bit of weight training is very, very important because it tones your body and it gives you bone mass also. So don't worry about the weight. The weight which you gain is your muscle weight. It's not your fat. And these days you have those body analyzers. You can definitely go and find out what kind of weight you're gaining, what is your percentage of fat in your body, percentage of muscle in your body, and it tells you very nicely.
So typically, a little bit of weight training is definitely
It's
important
good.
for
It's good.
overall health, bone health. Yeah, is good.
Right.
So what happens post menopause? Now that the woman has
There's no
menopause,
post-menopause.
okay,
You're in menopause lifelong. You're in menopause lifelong. And a lot of
okay,
women suffer for 10, 15 years with these symptoms.
wow,
So my message is don't
that's a lot.
suffer. Take help.
Yeah, yeah,
Yeah, and as I told you, the urinary tract symptoms can persist lifelong. So you can continue these medications lifelong. And these, as I talked about the laser therapy and all, these are all
hmm,
new therapies. So their lifespan, how soon you repeat it, it all is individual.
hmm. So, I also had a question from one of my audience, um, saying that, can I have a really active life? She's an athlete, yeah, sexual as well as physical, because she's an athlete. Yeah, after post, in my
Absolutely.
menopause. Yeah, nothing
Absolutely.
changes.
She can do it. There's no problem at all. Uh, the athletics, the activity is depending on her, how she continues her exercise regimen. And sexually, I don't think there should be a problem. If there is a drop in desire, as I said, we can give you testosterone, we can use vaginal creams to take care of the atrophy that happens. So, definitely, yes, I think a woman can lead a full life even at 75.
Hmm. Yeah. So, and she deserves all of it.
Yeah, why not? We've
Yeah.
worked really hard.
Yeah.
We are self-made people, and sometimes she deserves to be pampered also. So, men out there, please pamper her.
Yeah. So, any last message for the family who have women? Because I've heard that a lot. You're hormonal. You're
Yes,
hormonal. It goes like that. So, any message for the family?
I think you have to be very understanding and give her a little space, give her some room because she is undergoing, a withdrawal of these hormones, and that does cause a lot of symptoms. So you need to be sympathetic. If anybody is sick, how do we take care of them? So this is not a sickness, but yes, there are changes, there are symptoms, and a lot, and maybe 15 to 20% of the women really suffer. So I think if you can be supportive during that time, and the men need to understand what happens, and I think it'll be wonderful if you can, the woman feels neglected because children are already 15, 16. They don't need
Yeah.
the mother, and the husband's too busy earning money. 40 to 50 is doing very well. So
Yeah.
especially women who are sitting at home do feel neglected. So I think my advice to the women is it's a natural circle of life, so you should keep yourself occupied. You should get involved in activities which you like, have hobbies if you're not working, go help in charity work. That will give you a lot of mental stability, peace, that you're doing something useful. I think those are many things. And now COVID has taught all of us to value our time. I think use it fruitfully. Like I was listening to a lecture by the Brahma Kumaris the other day. Sister Shivani Didi was talking to our gynecologist, and she actually said, give 30 minutes for self.
Hmm.
And I think every woman, every man, everybody should actually give 30 minutes to self and just focus on what makes you happy. And I think that is eventually what is important. And if that
Yeah.
happiness, the menopause is coming in the way of that happiness, go to a doctor, get treated, and get back your happiness.
My God, I still remember those words you once told me, seize your happiness in the moment. And that's been my mantra ever since that day. So thank you for that. So I have a question from Miss or Mr. Kamal Khatri. How to prevent the dryness? I am assuming this is dryness of
Yeah,
vagina.
the vaginal
Yeah,
dryness.
yeah.
There are estradiol creams which are available. So, but I don't want to prescribe it on the net. You should
Yes.
see a gynecologist, and Do it. Another thing which we didn't talk about, Hema, I'm sorry, is you need to watch out for certain cancers. Once you
Okay.
cross the age of 40, you need to check for breast cancer,
Hmm.
colon cancer, and ovarian cancer. Now, the
Okay.
colon cancer is usually done by a colonoscopy. So once you cross 50, you must have one or two colonoscopies every 2, 3 years as your doctor prescribes. Mammography, normally we advise every year after 40. But now the self breast examination is
Hmm.
something that you should learn. There are many videos
Yeah.
online, and there are a lot of breast specialists who can actually teach you how to do it. That is one thing. And for the ovaries, you must do a sonography, must do a
Okay.
sonography every year. So I think doing a health checkup
Hmm.
for women when they hit menopause is extremely important. So women, please do not neglect yourself. And I do a good thing. Like on my birthday is the day when I will do all my tests. So I think we should fix a day which is good. On your birthday, you're treating
Yeah.
yourself. You go
That's
and
a
get your
nice thing.
thing, so that you don't miss
Yeah.
it. Otherwise, you miss
Yeah.
the day. You forget 1 year is up. So I think stick to your birthday or stick to your pet's birthday, whatever.
No, I think that's a good thing. That also kind of reminds you that you care for yourself if you take
Yeah.
that time out to go and do your health checkup.
Yeah.
I have a question. Do men have something similar to be conscious about?
There is something andropause, but I'm not going to talk about it right now.
Yeah.
We'll
Okay.
definitely, it's a whole topic by itself. And I'll give you a
Hmm.
specialist who will talk about andropause.
Okay.
I'm not
That'll be
the,
great. Uh,
I'm not
uh,
the first specialist.
yeah. So, to answer your question, there is something similar. We will take it up probably next time.
And I'll give you the name of the doctor who talks a lot
Oh,
about andropause and everything.
yeah,
Of
that
course,
will be
it's a
nice.
male. Of course, it's a male.
Thank you so much for that. Now, also, I wanted to touch base a little bit about on diet. Is there something special that women have to look out for, or they can just continue whatever they eat and however
I
they be? And
I think for heart health, you need your omega 3s. For
yeah,
bone health, you need your calcium and your vitamin D. So you should, uh, Hema, this is like,
never
standard.
in.
You
Yeah,
have
it's
to
standard.
have a very balanced diet. And nowadays,
Okay.
you have all these superfoods which women are having and all
Yeah,
that.
yeah.
It provides you with all the micronutrients and all. And also, you get a lot of pills. I think
Hmm.
there are so many pills for the 50 plus, 60 plus, 70 plus. When I travel abroad, I see it in all these,
Yeah,
pharmacies. So,
yeah.
yes, those pills, if you're not having a healthy diet, I think
Mhm.
you can take the supplements, but there's not much proven about it. But yes, I think good sunshine, healthy diet, and your bowel should be regular. If there's a problem with the bowel, I think that also causes a lot of, uh, you know,
Hmm.
imbalances in your body. So everything in general, I think a healthy life is very important. Exercise and diet. I would say that the Mediterranean diet is proven to be very, very good. But if you're a vegetarian, see that you get your proteins in sprouts, pulses in different forms, paneer. Cheese can
Hmm.
be fattening, but the thin people can definitely
Yeah.
go.
Yes. So it's majorly a balanced diet that you
Fruits
need
and
to
nuts,
go for.
fruits, nuts, vegetables. In fact, the world is turning vegetarian a lot,
Yes.
and it has been shown that the vegetarian diet causes less inflammation. It's less antigenic diet. All these
Yeah.
meats, poultry, milk products, they all are very antigenic foods. So they create inflammation. And most
Hmm.
of these diseases, the diabetes, the blood pressure, is supposed to be related to inflammation. So there are a lot of proponents who believe that diet can actually take care of your diseases.
Hmm.
And I think it comes back to the same age old, no? If you have a good
Yeah.
diet, you have a good healthy
Yeah.
life.
Absolutely. Absolutely. My grandmother's 94 years old and she's got the best bone health ever till date. Yeah. So I have a question on another chat, which is a relevant question. You did mention about mental health, bone health, and different systems of body. she asks me that which doctor should I go to? Should I go to a gynac? Should I go to a
I think
counselor?
a gynac. Gynac
A
is the
gynac.
first person. Gynecologist will be able to, get you sorted.
Okay.
What
Great.
you
I think a lot of our
we
questions.
discuss. One thing is, I do a lot of IVF in older women. Women get pregnant at 40 and 40 plus,
Wow.
and they have children
Yes.
and all that. What I have seen is that if you have a child a little later in life, the child actually keeps you young because you're interacting with the young mothers, all who are 20 something, and you're 40 something with the same child of the group. So I think those things are there. But if you get pregnant at a much older age, 40 plus and all, you can develop diabetes, you can develop blood pressure during pregnancy. So it's prudent to finish your childbearing as early as
Yeah.
possible. But I had this 50-year-old who gave birth to twins, and she walked home
Wow.
on Tuesday after delivery. Healthy
Wow.
woman, totally. So I think that inherent health, which if you
Hmm.
can achieve it,
Hmm.
it's
Hmm.
fantastic. It takes you flying through the menopause. Beautiful.
Wow. So there are two very strong messages. If wives are watching this, you ought to show this to your husbands, and if parents are watching this, show it to your daughter. It's very important. Any last words for our people?
I think menopause is just a phase in your life. You need to overcome it and enjoy this transition and this phase of your life. So, quality is very important. If it's getting affected, please take help.
Amazing. And I think I will end it with her last few words. Seize your happiness when you can. So thank you so much. I think we had a lovely talk, and hopefully all of you had a good time as well. Take care and good night, all of you.
Good
Bye.
night. Good night, everybody. Thank you. Thank you, Hema. Bye
Thank
bye.
you. Bye.